I have one Dr. Nemechek here. I want to kick off a new series we're going to do. It's called Week in Review, and I'm going to touch on just some patients that have come through this week, and just give you a feel for what we're seeing and what happens. And they're very short, just little overviews, and we'll leave some comments. Tell me if you like this, and we can do more of this. So we're going to go over just 4 cases real briefly. This is a little boy, 9, and he started the protocol in 2021, so about 4 years ago. Tics, bad tics, obsessive compulsive disorder, attention deficit hyperactivity disorder, and severe dyslexia, really bad. So he's basically put on the basic protocol: fish oil, olive oil, and we started with inulin, and then over time that wasn't working, so he was on continuous rifaximin, and that really helped a lot. So he's now only on intermittent rifaximin, and he'll get 10 days a month if he starts getting this abdominal cramping when his SIBO relapses. And basically after 4 years, this kid's normal. No therapy, nothing. His dyslexia is completely gone as far as anybody can tell, and they said he's reading proficiently at his grade level, has good comprehension, and so forth, and his tics and OCD and aggression have resolved. So he's basically seeing me 2-3 times a year just on routine follow-up and kind of maintenance, and giving him refills of rifaximin and so forth. Next is older woman, female, 41 years old. She started about 6 years ago, actually. She's been around for a while in the practice. Super lightheaded, dizzy, headaches, fatigue, intolerance to all sorts of kinds of foods. And so she's put out fish oil, olive oil, and continuous rifaximin. Now, at this age, everybody gets vagus nerve stimulation, so to get them to recover. And she's done really well, and we ended up adding some neomycin for our archaea overgrowth that was contributing to her constipation. So now she's just on intermittent rifaximin and neomycin, and her primary symptoms are she might get a little lightheaded, and her constipation starts getting bad. And she's pretty much, again, she's completely recovered for the most part, and really her symptoms might come back if she starts feeling a little lightheaded and the constipation, and there's just a lot of patients are kind of like, I don't know if I want to do this, don't know if I want to do this yet, and that's the only time. But then she'll take 10 days of rifaximin and neomycin, boom, gone. And so she's doing real well. We had a 13-year-old boy. Again, he started on the protocol in 2020, so it's been about 5 years for him. He started when he was 8. Autism, developmental delay, a lot of dysautonomia, autonomic nervous system dysfunction, OCD. In his case, it's very different. He had a fairly significant stroke at birth. He's on fish oil and olive oil because of the stroke. We started him on vagus nerve stimulation, and at 8 years old, we started with inulin, and we ended up shifting up to, it wasn't potent enough, to rifaximin, and we ultimately went to, he's on twice-a-day rifaximin plus twice-a-day inulin. And so these are 2 therapies. These are 2 different ways to suppress bacterial overgrowth, and I'll find at times that both of them together work much better than either alone, and that was the case for him. Now, it hasn't been some skyrocket, unbelievable recovery. It's been, basically slow but steady, all right? It's been 5 years. Now, he's very calm. His OCD and hyperactivity are almost non-existent, except for if he's under a lot of stress, it'll kind of come out a bit. Comprehension and just purposefulness and just kind of engaging is greatly improved. He was kind of just, zombie overstates it, but he with minimal interaction. Socially, it's really sweet. He's seeking out his parents and his siblings, just kind of for comfort, just to kind of snuggle up with them, and but we still don't have any speech yet. But we're gaining a lot, from he started at 8, and it was like almost no gains, his entire life up to that point. So we look forward to working with him for a long time and helping him continually kind of scratch out more and more gains. And then we got a 15-year-old boy. He started the protocol here in 2021, so 4 years ago. No autism, but extreme aggression, oppositional defiance disorder, and pretty bad ADHD. We put him on fish oil and olive oil. We eventually added the midodrine. So midodrine helps improve. So the ADD or ADHD are from low blood pressure in the brain. And so the midodrine kind of gently boosts pressure so that now you have better pressure in the brain. That means more oxygen can jump into the neurons correctly that you need. And started on cyclic rifaximin with the continuous, and like that other case, he's now on continuous rifaximin plus twice a day inulin. So inulin rifaximin in the morning, inulin rifaximin in the evening, and he's doing great. He's at peer level with all subjects. Aggression is very rare, but very mild. And the oppositional defiance disorder has resolved to where the mom said, oh, he's a little defiant at times, but he's pretty much just like all my other teenagers. So she says it's appropriate for his age. And socially, whoops, I left these 3 lines down here are not necessary. So doing good. Aggression, ODD's gone. Academically doing well. So if you like this kind of thing, let me know. Otherwise, hit subscribe and hear more about it. And you all have a nice day. Take care.